Starting off with COVID-19 coverage and a big announcement from the state today. Effective April 1st, people attending large indoor events, mega events, will no longer need to show proof of vaccination or a negative COVID test.
This would apply to events with more than 1,000 people. Now, venues can still choose to require proof if they want, but it's no longer mandatory on a statewide level. Health leaders do recommend wearing a mask if you're in a large crowd. Tomorrow, UC Davis will lift its indoor mask mandate. Masks will no longer be required in classrooms, but masks are still recommended. Regular COVID testing on that campus is still required. So those restrictions are set to lift as COVID cases are dropping across California.
Here's the graphs that show it. It shows the cases since the start of the pandemic, and the state reported 4,500 new infections. That was yesterday, and the test positivity rate is at 1.5%. Now to hospitalizations, also on the decline. About 2,000 people are in the hospital with COVID statewide. And a subvariant of the Omicron variant is becoming more prevalent. The BA.2 variant has driven a recent surge in cases in the UK, growing 80% faster than the original Omicron variant.
So people have been watching this really closely. BA.2 has been detected through wastewater testing here in Northern California, so some people are wondering if we could see another surge. UC Davis Health pediatric infectious disease expert Dr. Dean Blumberg joins us now. Thank you so much for joining us. How high is the risk of this subvariant and whether we could see another spike?
Oh, it's 80% more transmissible than the original Omicron strain, and it's about 23% of the circulating strains in the U.S. right now. It's been tripling in proportion every 2 weeks, and studies in other countries suggest that if it reaches 50% of the circulating strains, that's the tipping point where a surge then occurs.
Now that we're in the endemic phase of the pandemic, how worried should people be about this new variant?
You know, every new variant, we're not sure exactly how it's going to react and if it's going to lead to a surge or not. So I think, we need to pay attention to all of these and then see what's going to happen. In other countries, it has led to a surge when it's reached a significant proportion. In the UK, it accounts for about 82% of the circulating strains, and they're having a surge. In Denmark, it accounts for 99% of the strains, and they're having a surge also.
So, I mean, we've been talking to you now for 2 years of this pandemic plus. We've learned a lot. So what difference does that make now that we're seeing a new variant, but we know more about how this virus acts, we know more about how to treat it?
Well, we have learned a lot. Everybody's more aware of the virology and epidemiology now, not just scientists. But there's still a lot that we don't know. So we know that people are immune after vaccination or infection for about 3 or 4 months. But then immunity does wane and the breakthrough infections may occur. So we had that surge in January, in late January when it peaked. And so we think that maybe in late April or May, we might be prone to another surge, but we're still learning about the dynamics about immunity within populations and how that relates to these variants.
Dr. Blumberg, I want to get you to weigh in on one of the headlines, the COVID headlines here in the state. On April 1st, indoor mega events are now, you don't need to show proof of vaccination. A lot of restrictions are going away. Do you agree with that? Do you think that's a good idea? What's your stance?
I mean, we're all tired of the lockdown. We've limited ourselves in terms of our opportunities of experiencing things together. We all want to get back to normal. So I think it's great to make those plans to do that, but be aware that we might have to change our plans depending on circumstances. We should hope for the best, but need to be flexible, and maybe masking is going to be reinstituted. I hope not. I hope that's not necessary, but it might be.
Yeah, we share that hope. Dr. Blumberg, thank you so much for your expertise.
Thank you.